Pregnancy is a wonderful gift of God. The Almighty has blessed every mother with the miraculous power to give birth to a life. She does the biggest service to the mankind by bearing enormous agony and in taking all the efforts to give birth to a baby, as she does it to continue the human race. In womb, the baby is entirely dependent as a parasite on the mother's blood for all the nutritional requirements necessary for its optimum growth and development. The regular antenatal exercises offer many advantages both to the mother and the baby, including the increase in blood circulation to the placenta and subsequently to the fetus, thereby ensuring that the baby is able to achieve its full genetic potential. The adequate nutrition and oxygen supply and efficient disposal of metabolic wastes through the improved blood circulation to the placenta protects the baby from both the growth restriction and the macrosomia. The mothers who sincerely do regular antenatal exercises are more likely to carry the pregnancy up to term, thereby reducing the risk of premature birth and its complications in the baby. In mother, the regular exercises increases her physical stamina and endurance and allays her mental and emotional stress, thereby leading to eternal peace and harmony within. The baby in womb is entirely dependent on glucose for its calorie requirements. To ensure the uninterrupted glucose supply to the baby, the nature has crafted pregnancy as a pseudo-diabetic state with insulin resistance in the mother, so that mother derive her majority of energy requirements from the fats and proteins, and the glucose is spared to fulfill the baby's needs. But due to faulty metabolism, around 10% of the mothers, especially those suffering from polycystic ovarian syndrome, are at risk of developing gestational diabetes and pregnancy-induced hypertension, and hence the regular antenatal exercises can offer protection against these metabolic disorders. During pregnancy, the gravid uterus presses over the inferior vena cava vessel and impedes the return of blood from the lower limbs back to the heart, resulting in poor blood circulation and stasis of blood in the legs. This, in addition to hypercoagulability of blood due to increased levels of coagulation factors, increases the risk of formation of blood clots in the mother's legs, resulting in deep vein thrombosis and subsequently leading to life-threatening pulmonary embolism when this clot dislodge upwards and block the pulmonary blood vessels. Thus, the regular walking and exercises of calf muscles improves the blood circulation and offers protection against fetal, DVT and pulmonary embolism. So, there is no role of strict bed rest in pregnancy. All the pregnant mothers should do regular antenatal exercises under the supervision of an expert. Most exercises are safe to perform as long as the mother exercises with caution and do not overdo it, or unless they are medically contraindicated during pregnancy by the healthcare provider, like in cases of threatened abortion, placenta previa where there is active bleeding, or lethal diseases like heart disease, uncontrolled asthma, etc., where there is risk to the mother. Recommended exercises in pregnancy. Regular light walk. It is advisable for the pregnant mothers to do regular light walk in the morning and in the evening in comfortable atmosphere with fresh air. Light walk is the best exercise with no risk of fall or injury whatsoever. For any reason, if the mother is not able to go out for a walk, she should at least do step march for 15 to 20 minutes. There are certain precautions to be taken care of. Walk on flat, even surfaces and avoid slippery places. Do not walk in crowded places as it increases the risk of accidental injuries. Wear comfortable clothes and shoes. Ensure that you are well hydrated. If you have eyesight problem, do wear appropriate spectacles. And most importantly, do not use mobile phones or other gadgets while walking that distract your concentration. As the pregnancy advances and abdomen distends, especially in the last trimester, the floor visibility is hampered. Due to the shift of center of gravity and resultant changes in the curvature of the spine, the mother develops waddling duck gait. This in addition to the laxity of joints and muscles under the influence of progesterone and relaxin hormones, the mother has lesser control over her body and higher risk of imbalance and fall. So, it is important to take extra care while walking. Remember, safety first, as your safety is your baby's safety. Spine strengthening exercises. In pregnancy, due to change in the curvature of the spine and laxity of joints, the mother often experiences neck pain, lower backache and sciatica pain, radiating down to the legs due to compression of the sciatic nerves. The spine strengthening exercises help the alignment and strengthening of spine and reduces the aches and pains associated with the pregnancy. Neck rotation exercises. These exercises help the alignment and strengthening of cervical spine and reduce the neck pain associated with the pregnancy. Stand straight with your legs wide apart by 1 feet distance with equal pressures on both the legs. Rotate your neck clockwise and then anti-clockwise. Repeat this exercise at least 5 times. Now extend your neck backwards so that you look up at the sky. Feel the stretch. Now flex your neck so that your chin touches the chest. Repeat this exercise at least 5 times. Shoulder rotation exercises. Stand straight with your legs wide apart by 1 feet distance with equal pressures on both legs. Flex your elbow and place your folded fingers on the shoulders. Rotate the shoulder cuff forward backwards and then backward forward, feeling the stretch at rotator cuff muscles. Repeat the exercise at least 5 times. Waist rotation exercise. Stand straight with your legs wide apart by 1 feet distance with equal pressures on both the legs. Place your hands over the waistline. Rotate your waist clockwise and then anti-clockwise. Repeat this exercise at least 5 times. Twist exercise. This can be done in 2 ways, while standing and while lying supine. Stand straight with your legs wide apart by 1 feet distance with equal pressures on both the legs. Place your hands with elbows flexed in front of the chest. Slowly twist your upper torso at waist to right and then to left. Repeat this exercise at least 5 times. Lie down supine with your knees flexed. Spread your arms wide in line with shoulders. Twist your upper torso at waist to right and your lower torso along with the knee to the left. Feel the stretch at the spine. Repeat the same on opposite side. Do this cycle at least 5 times. Air squats. Stand straight with your legs wide apart by 1 feet distance with equal pressures on both the legs and your back straight. You can do this exercise both with bent or extended arms as per your convenience. Flex your knees as if you are trying to sit on a virtual chair. Hold for a few seconds and then stand straight. Repeat this exercise at least 5 times. Yoga in pregnancy. Yoga is a group of physical and breathing exercises combined with the meditation practices that helps in physical, mental and spiritual well-being and improves mother's immunity. It promotes rejuvenation of mind, body and soul. Yastikasana. It reduces back pain and mental stress and promotes complete relaxation. Lie down on the flat surface with both legs straight. Extend both hands overhead. Take deep breath and stretch whole body. Remain in the stretched position for some time and then relax. Repeat the same at least 5 times. Tadasana or mountain pose. It strengthens the vertebral muscles and relieves the backache. It also aids in lung expansion. Stand upright, spreading the legs with equal pressures on both. Keep spine straight with hands by the side of the thigh. Take deep breath and extend both hands overhead without bending the elbow. Look up at the fingers. Feel the stretch. Stay in the same position for a few seconds. Exhale and resume initial relaxed position. Veerbhadrasana or warrior pose. It is beneficial for the back, chest and thigh muscles. It also improves body posture. By stretching and strengthening the pelvic muscles and promoting joint relaxation, it aids in normal vaginal delivery. Stand straight with your legs wide apart by at least 3 to 4 feet. Keep your palms open by side of the thigh. Turn right foot and body out by 90 degrees and left foot in by 15 degrees. Bend right knee. Take deep breath and stretch both hands upwards. Bend your spine backwards and look up at the fingers. Feel the stretch all over the body and remain in the same position for a few minutes. Now relax your body and resume initial position. Take care to avoid imbalance and fall. Trikonasana. This relaxes waist and hip joints and muscles and aids in normal vaginal delivery. Stand straight with your legs wide apart by at least 3 to 4 feet. Keep your palms open by the side of the thigh. Keeping elbows straight, stretch both hands to the levels of the shoulders with palms facing towards the ground. Take a deep breath and then bend over at the waist to the left so that left palm is touching the ground and the right hand goes overhead up in the sky. Look up at the right hand. Take normal breaths and feel the stretch. Remain in the same position for some time. Relax and resume the initial position. Repeat the process on the opposite side. Butterfly or cobbler posture. This is one of the most important exercises recommended in pregnancy. It strengthens pelvic floor muscles that aids in normal vaginal delivery. It also relaxes calf and thigh muscles and relieves pain. It improves digestive system. Sit on the ground with both the knees folded so that 2 feet touch each other like a cobbler sits. Keep the spine straight. Dangle to touch the knees to the ground and feel the stretch. Do this for at least 5 minutes. Kegel exercise. Another most important antenatal and postnatal exercise. Antenatal, it strengthens pelvic floor muscles and aids in normal vaginal delivery. Post-delivery, it helps in toning and regaining the strength of vaginal and surrounding pelvic muscles, thereby preventing urinary, flatus or fecal incontinence, resulting from the dysfunction of these muscles due to obstetric trauma of birthing. It can be performed 2 ways, while lying down and while sitting. In lying down position, lie supine with your knees flexed. Place your arms by the side of the body with your palms facing the ground. By applying the downward pressure by your palms on the ground, lift your buttocks up. Hold for some time and feel the stretch. Now resume your initial normal position. Repeat this exercise at least 5 times. In sitting position, sit with your back straight. Take deep breath. Contract and pull the perineal muscles in and hold for a few moments. Feel the tension in vaginal and anal muscles. Relax and release the tension. Do at least 8 to 10 times and repeat such 10 cycles in a day. There are certain precautions to be taken care while performing yoga. Do them only under the supervision of an expert trainer. Wear loose, comfortable clothes. Preferably, do them in the morning or evening in open and comfortable environment with fresh air. On empty stomach, and do not do immediately after taking meals. Start with simple procedures first and then upgrade. Do not do complex and difficult exercises from the beginning. Do not unnecessarily strain yourself. Remember, if you are comfortable, your baby is comfortable. Do not do those exercises that risk imbalance and fall or unduly increases intra-abdominal pressures. Do not hold the breath for long, as it may deprive your baby of oxygen. Swimming. It is a complete exercise on its own, training and strengthening all the muscles and joints of the body, including the pelvic muscles. It promotes physical fitness and rejuvenates mind, body and soul. It prepares you for normal vaginal delivery. Swimming is absolutely safe in pregnancy, but ensure that swimming pool is hygienic with absolutely clean water at optimum temperature. Avoid slippery surface that risk fall and injury. Do not dive, and most importantly, after swimming, wipe yourself dry properly to avoid fungal or skin infections due to moisture. Pranayama or deep breathing exercises are focused breathing techniques that ensure inhalation of fresh air rich in oxygen and exhalation of waste carbon dioxide. The increased oxygenation helps both mother and the fetus. In mother, it promotes the physical stamina, endurance and immunity and relieves her of mental and emotional stress. Whereas in baby, it promotes growth and development and prevents prematurity and growth restriction. The deep breathing also improves maternal lung capacity and blood circulation by movements of the pulmonary diaphragm and helps to prepare her for bearing down during labor pains. Om chanting. Om is considered to be a holy sound that exists everywhere in the entire universe, within every word, every being or everything. It is considered the positive vibration which on chanting promotes physical, mental and spiritual well-being and rejuvenation of complete mind, body and soul. Sit in relaxed position with crossed legs. Hold your back straight. Place your hands over your knee with your thumb approximating the index finger. Close your eyes. Take deep breath in. Hold it and try to chant Om as long as your stamina permits without strain. Draw the sound from the navel. Allow the vibration to rise upwards gradually until it rings in your nostrils. Repeat Om in a slow rhythmic way. Anulom Vilom. This exercise focuses on alternate nostril breathing. It helps improve oxygenation of blood, strengthens respiratory system, relieves mental and emotional stress and leads to harmony within. Sit in relaxed position with crossed legs. Hold your back straight. Place the forefinger and middle finger of the right hand rest between the eyebrows, with your thumb closing the right nostril. Inhale through the open left nostril. Then release the thumb and place your ring and little fingers over the left nostril to close it. Exhale from the right open nostril. This cycle is completed with inhaling from the right nostril and exhaling through the left. Repeat the cycle at least 5 times. There are certain precautions to be taken while performing pranayama. The pranayama should be done under the supervision of trained personnel only. Preferably do them in the morning or evening in open and comfortable environment with fresh air. Do not do immediately after taking meals. Those breathing exercises that unduly increase intra-abdominal pressures like Kapalbhati should be avoided. Do not hold breath for long, as it may deprive your baby of oxygen. Are there any exercises that should be avoided during pregnancy? Certainly yes. Those exercises that risk injury to the mother or fetus should be avoided in pregnancy, like skiing, horseback riding, jumping, hopping, skipping, bouncing or running. Contact sports such as softball, football, basketball and volleyball. And those activities that include jarring motions or rapid changes in direction. While exercising, kindly keep a watch on certain danger signals. Stop exercises and consult your healthcare provider if you experience abnormal chest, abdominal or pelvic pain, or persistent uterine contractions, have severe intractable headache, blurring of vision, fainting, dizziness or lightheadedness, irregular rapid heartbeat or palpitations, shortness of breath or air hunger, difficulty moving or excessive muscle weakness, sudden swelling in your ankles, hands, face or calf pain, absence or decreased fetal movements, vaginal bleeding or sudden gush of amniotic fluid leak from the vagina. Remember, you are becoming creator by giving birth to a life. The little God has chosen you to come into this world. So, it is your moral responsibility to take best of care to welcome the little angel into this world. Wish you safe and happy pregnancy.